Hello and welcome to another exciting episode of We the Doctors. My name is Dr. Jules. Today we'll be talking about the topic called urinary tract infection. They used to refer to it as UTI. And you know, when we talk about topics, I don't do it alone. I have my colleagues with me, Dr. Valeria, Dr. Yvonne, and Dr. Oke. Now, let me just introduce the topic before we dive into it, okay? UTI basically is a common bacterial infection that affects most humans in the community or in a hospital setting. And it involves a lot of expenditure as a country. For the United States, for instance, in a year, they spend $1.6 billion on UTI alone. Wow. So we don't have the statistics, but I'm sure
the budget of our whole healthcare.
That's why they have to put more consideration into healthcare. Exactly.
Yeah, we'll be all right.
Wow. A lot of people, most adults, it occurs in all age groups.
Yes.
But most adults must have experienced UTI at one point or another. So what we do on this show is to help you identify and recognize these medical conditions so that you know what you're dealing with, so that you make informed health care choices, okay? So let's start off with the symptoms, the basic symptoms. Yeah. I'll kick it off, okay? And talk about what most of us experience when we are ill or fighting some form of infection. Fever, okay? When you have UTI, you can experience fever, okay? That's why we keep saying self-medication, you have to be careful. Exactly. It could be something else. There are some other basic symptoms which we'll be discussing, but fever is definitely one of them. Then, of course, the classical one, pain when you urinate. That's what most of the patients will come. That's what will bring them in the first place. You're at home, there's a fever, you've been taking Panadol, nothing is happening. There's this pain that comes when you urinate. Of course, that's a red flag. Yeah, you might be having a UTI.
Burning sensation.
Exactly.
It's quite interesting. And then talking about urinary tract infection, basically, some people may still be wondering, basically, you just know that the function of the urinary tract is get rid of urine out of the body system and all of that. So when that tract itself is infected, later on, Dr. Yvonne will be explaining further how the kidneys go join with the urethras and the bladder, and then you have the urethra where the urine actually comes out from, and then we go on and on from there. But talking about the symptoms right now, one of the things that they complain about is that sometimes they have what they call low abdominal pain. Sometimes, and some people even complain about back pain, basically because you know that the kidneys, coming from that region. Dr. Yvonne will be explaining that later on. So some women come and say that, look, this part of my stomach really, hurts and all of that. And Dr. Jules earlier had mentioned that they have dysuria. That means that whenever they want to pee, it's always a bit, painful and all of that. And then one of the things
Dr. Jules said something simple. He said, pain on urination. You now use the big word,
dysuria. That's how you know.
Is that the medical term? Anyway,
the medical term is dysuria. Anyway, so when your doctor says dysuria, that's what he means.
And then some other people also have frequency. When urinating, you just realize that every minute you're going.
And the thing about it is that the urine that comes out is so little. As in when you'll be like, what just happened? Yeah, because nothing is coming out.
But anyway, the other conditions, you can have that frequency also. Sometimes you're having diabetes and even other meals.
So they may mix it up
drinking lots of water.
So it's not after this show you say I've urinated frequently.
No.
So I have UTI. It doesn't work that way.
And even,
additionally, when Dr. Jules mentioned fever, one other thing we always find with fever is this feeling of cold. In the hospital, we'll say you have chills, feeling of cold. And then, this is common in the hospital. Somebody walks up to you and says, doctor, I think I have malaria. And then the next thing you're like, why do you think so? He said, the smell of my urine has changed. I would, in UTI, consider the smell of your urine as one of those last things that could lead us to.
And even the appearance, it looks cloudy. Sometimes it could be blood stained too. It could be some, as in drops of blood in it.
Sometimes I wonder where people get that relationship between malaria and the change in the color of
everything that happens to you. Nigeria has malaria. I think one of these days we need to talk about malaria.
I think the challenge is, honestly, because we have so much malaria in the environment. So once you have fever, they say common things occur commonly.
Exactly,
so
that's where...
fever, with whatever it is malaria. Fever and cough, they say is malaria. Fever and urinary and pain when urinating.
And like Dr. Valeria mentioned earlier on, when the infection actually now goes up to affect the kidneys, they now start complaining of things like low back pain. We said that earlier on. Then nausea and vomiting. Those ones are also associated with the fever, chills, just so many symptoms like that come up.
Exactly. And to understand the topic, vividly, it's very important that they understand what the urinary tract is like and understand how the infection can ascend and involve your kidneys, okay? So you want to stay tuned. When we come back, Dr. Yvonne will be leading us on that. Stay tuned.
Coming up next.
Other than the urethra. So the infection actually affects these structures, and it's from these structures that urine passes to outside of the body. Hello, and you're welcome back to We the Doctors. It's been an interesting topic today, UTI. And on this segment, we'll be talking about the risk factors for UTI, urinary tract infection. But before we start, we'd like to talk a bit about the urinary system, because this is where this infection takes place. It comprises of the kidneys, the ureters, bladder, then the urethra. So the infection actually affects these structures, and it's from these structures that urine passes to outside of the body. There are two main causes of urinary tract infection: poor hygiene and sexual intercourse. But we'll deliberate on that as we speak about the risk factors. The first one I would like to talk about now is the cleaning method.
Exactly.
Most times women are supposed to wipe from front to the back, but most times they do it the wrong way, which is from back to the front.
Exactly.
Sometimes little kids that have seen their elder sisters or their moms wiping, they don't know how to, and they go the wrong way, thereby introducing bacteria from the feces, because the anus is close to the urethra.
Not
and
like
for
seeing
females,
their mom do it, but do it on them.
So they have a bad toilet.
exactly.
Yes. So
That's why I
when they
said
wipe
poor
them,
hygiene.
Just wondered.
Yes, when
And
you
so-
said, you see, the mommy or the auntie, I'm like,
And
okay,
so,
on
yeah.
them, yes.
And the female urethra is very short.
short, yeah.
So it's easy for this bacteria to actually just go and swim up, so causing urinary tract infection.
Exactly.
Yeah, basically, I think it's more, once we understand that the infection is something that goes up, it's an ascending thing from the urethra, that's the outer part where we all pee from.
Yes.
It keeps climbing up. You now understand all these risk factors we explained. For example, when I say if you don't drink enough water, you are likely to get urinary tract infection.
True.
It's because the water flushes down the system and you get to pee it out. So not drinking enough water is a risk factor. Then something that we often don't consider, but it's true as a risk factor, is people that use bathtubs are more likely to get urinary tract infection than people that do showers.
Okay, that puts water in the bath and stay in
And
the...
soak in
Because
it.
when you're in the bathtub, you have this pressure pushing from the water. You are bubbling in it. It's like a jacuzzi. You have this pressure pushing the fluids back up
Yes.
instead of pushing it back down.
Yeah.
Now, that doesn't mean you should run away from your bathtubs, but
Exactly.
minimize the long soaks.
Have you thought about the women that go to the bush to pee and you bend down very well?
As in,
And then you go really
Really low.
And then you know some of those things that you see squirting around, and they just grab your urine.
Dr. Wale has such a vivid imagination.
And then it goes all the way up.
Okay.
And then before you know it,
Something
there's
has
UTI,
happened. Okay, after that horror story, I would, feed off what Dr. Yvonne said about this infection ascending upwards. Okay, we have a practice that some ladies practice, douching and some form of hygiene. You want to wash yourself down there, and then you use a wash and force it up your... Exactly.
Especially when the person has poor anal hygiene.
Everything up. Splashing water all over the place. There's no good hygiene. You are causing problems, okay? And besides, in that area, it is naturally acidic.
Yes.
So when you use these washes,
Which
you
area?
want the genital area.
Okay.
Your area.
The female genital area, okay? It's
Okay.
usually acidic.
Yeah.
Now, when you use this wash, it's going to become alkaline. And the way we are created is for it to be acidic, and then it helps to prevent us from having these infections.
Yes.
Now, when you use this wash too often, to be honest, there's a research that was done that all you need is just warm water. And you are fine. You don't need to use all these. I think these things are like
the sprays,
commercial jargon, for us to buy.
Yeah.
So you don't want to indulge in those practices.
Additionally, this is just a little of an aside. There was this toilet seat that was made, and the plan was after using it, it flushes upwards just to clean you up.
Oh my goodness.
Yeah, before you. And it didn't take hold because I think maybe doctors had said, this is UTI, this is UTI.
Yes.
Growing up as kids, we used to relax and, tell all those lies of how our own toilet seat at home will clean you up. You don't have to use the tissue.
Interesting.
Yeah, and the very simple one too. The very simple one that people take for granted, holding pee for a very long time. It's not really very good at all because some people are actually so lazy, plane flights of maybe 6 hours, even up to 11 hours. Some people won't even stand up to urinate. I don't understand. They are shy.
You know the funny thing there? They say they want to avoid the toilet in the plane because they think that's what's going to give them a UTI. And they forget that it's the holding the urine
for that long.
Exactly gives them
because
the
it
UTI.
allows the germs to, survive for a longer time, attaching to the walls of all those structures.
Yeah, so we got a lot of all of these things. Earlier on, Dr. Jules, you were talking about something that had to do with pregnancy.
Contraceptives, actually. Contraceptives like diaphragms. Unlike the condoms, you have to use them more than once. So how you take care of your diaphragm is very important. It can be a source of infection. And then you have condoms. Some condoms expire. So you have to look at the expiry dates because most of them can lose the lubrication on them. And that causes friction. It can predispose to UTI as well.
All right, so some other disease conditions, some other disease conditions can also, predispose you to urinary tract infection. For example, if someone who is diabetic and some other people that have some immunocompromised issues and all of that. Because of that, your immune system is reduced and you're prone to having infections and then you can easily get urinary tract infections, so to say that way. And then some people who are in the hospital will have like an indwelling catheter. Meaning that, some people will have issues urinating or who cannot move around to go and urinate and then they have to pass it like a pipe through the area so that urine can come out and all of that.
Through what area?
Through the genital area, so to say.
There you go. Dr. OK was on the streets earlier today. Let's go there. Because he was actually talking to somebody, talking about how can UTI be contracted. So please, we want you to stay tuned. Do not go anywhere because we'll be right back.
Basically, it's something or it's a disease that I know most people contract from public toilets majorly or when sharing toilets with 1 or 2 people, you understand? And it could much be prevented when we have, of course, a cleaner environment, when the environment is well tidied up and put together. So we can, at least it can be curbed through that means. Yeah.
When you urinate, where people used to urinate, you can contact urinary infection from there.
I don't really know much about it, but all I know is that it's infection mostly gotten from the toilet, in dirty environments. That's it.
Yeah, it's an infection. When you have sex with somebody that have it, somebody can surely contact it. Yeah.
When there is dustbin or so dirty somewhere, and you went there to go and urinate, you can contact urinary infection through that.
Well, no, it's not. I don't think it's a disease contracted from human being, from other. It's an internal, a urinary tract. It's a urinary tract.
What I know about it is that you can contract it through the toilet usage, as in mostly public toilets. So that's why you need to be, the toilet must be properly clean. So you need to clean yourself well because of contaminating any disease. That's it.
Hello and you're welcome back. If you're just joining us, this is With the Doctors, and we have been talking about urinary tract infection, also known as UTI. My name is Dr. Valeria. On this segment, we're going to be giving you tips or ways you can prevent urinary tract infection. One of the major things I think you should do is to drink a lot of water. You know, drinking water gives you the urge to want to pee, and in so doing, you tend to pee out all the things out of your system, get out the bacteria and all of that from your system easily. So drinking a lot of water, you get the urge to pee, and then it's out.
It's interesting, the comical way Dr. Valeria
And again,
talks about all these serious things. And makes
A very serious
everybody
matter.
laugh.
Just sounds like a
Exactly.
joke.
But it's quite
Exactly.
pleasant.
Apart from drinking water, drinking cranberry juice also helps.
Yes, sir.
Because it prevents the bacteria from sticking to the walls of the structures around you. So it helps a great deal.
And it also increases the acidity of the urine itself.
Yes.
That's why people take it, to add to that. And then, talking about the way we wipe, we mentioned it earlier. I think it should start from the caregiver of the child, especially the female child. If you have to wipe, it has to be from front to the back. Because of what we explained earlier, the urethra is very short and infection can travel up, especially when you take feces to the front, okay? So you want to do front to back. And of course, when you start that in the care of your toddler during potty training, they'll grow up with it.
Dr. Joe, let's specify when talking about these kids. Is the female ones or for the
Yes, the
boys?
female ones.
The
But
boys will be wiping.
but I think it's also important for the boys, especially as kids.
How would they wipe?
Because
back to front?
as kids, when children develop UTI, for boys, let's remember that they're in diapers.
True.
So when you wipe that way for them, remember, imagine cleaning up a child.
True,
When you
it's
wipe
true.
forward for them, it's not every time you get to do a full wash.
Exactly.
You just use baby wipes and do all that.
True.
It stays in there with the diaper, so it increases the exposure time, and the boys also have a higher chance or tendency
And
of getting-
babies too
Yeah.
can have UTI.
course.
It's not
Okay,
an
that's what I'm talking-
adult
yes. Yeah.
disease. So it's good that you mentioned that, because sometimes you see a child, the child will have fever. There's a practice. Some people will call the doctor and say, my child has a fever. What can I give the child? It is not ethical for you to now prescribe anything, because it can be something else. We take the urine of a baby, of a child to test. So please, 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 kids can have UTI.
And
Yeah,
my
other-
little advice, please pee early. Pee
Yes,
early.
don't hold the
Yeah.
pee.
That's another
And
big one.
as I say, if you can shower. You don't have to always.
Sit in
Okay,
the
don't spoil market for bathtub.
But we are saying bathtubs, not pools now.
Yeah.
Yeah.
It doesn't apply to
Yeah.
pools.
Just
because
long stay in the tub.
if it is well chlorinated.
And on Twitter, and we have a question.
Okay.
Yeah, our question came from Ifoma. It's the same thing we've been talking about. Ifoma wants to know that is it possible for a child to have a urinary tract infection, seeing that the child hasn't had any sexual exposure and the child hasn't even started potty training? I think we've already explained it
Exactly.
all.
With a beautiful
UTIs are really different from sexually transmitted infections.
Absolutely.
So,
Even though they present the same way.
yeah. So a
It's
baby,
important why you go to the hospital so they can differentiate and tell you which exactly you're having.
True.
yes. So a baby can have it.
True.
We've already said wipe
Front to back.
front to back and not back to front. And we've explained it applies even to your boys. Because you're not going to come and tell me it's just
Thank
a
you
baby
for
girl.
pointing
did it
that out.
No, it's baby boy.
Even baby boy, yes, even to your baby boy. Then change. Which boy do you mean? Baby boy, yes.
No, you said no, your boys. I said baby boy.
Okay, so again, change diapers early for the children. It's important.
Very, very.
You don't have to wait till, because they
They're
peed.
trying to conserve money.
Yeah.
For
I
the
know.
Yeah,
We
because-
only use 2 diapers per
a
day.
day.
Really?
Some people do, yes.
Sometimes you use 2 diapers in an hour because they peed. And
Sometimes it is even healthier to use the napkins because it
Yes.
breathes.
Yes.
You can
Unlike
use
the
it
other
and
one.
wash it. It's don't. Maybe if a parent might
they
feel
think
it's
it's
trendy to
outdated
use
that
it's outdated.
I think we have
Trust
to
me.
help diaper companies with their research on breeding diapers.
Maybe
but
you
that
have the
aside,
commission.
change the diapers early. That's what's important.
Early,
Change these
exactly.
diapers
And if
early.
you can't afford a
Yeah.
diaper, at least have a good hygiene.
Yes.
Maintain the napkins properly.
And then thirdly, for your child, if at any point you sense this child has got a UTI, treat early. Because complications of UTI would stay longer with you. Imagine you are more prone to a complication if the child got started.
That's really, really important. That's one very good thing you just, I'm glad you mentioned it. Because of the complication of urinary tract infection, you don't want to, mess around with it, basically.
Can ascend as far as becoming a kidney problem, kidney failure and all that.
Yes.
Okay, so that's it for today. We've been talking about urinary tract infections. My goodness. So basically, early detection, you want to go to the hospital. We mentioned also when we're talking to the consultants about testing your urine. It's very important because we have to isolate the bacteria and check out for the sensitivity. If you have more questions, you want to send it to @WeTheDoctors. Of course, our website remains cooltv.cool for myself, Dr. Jules, Dr. Valeria, Dr. Yvonne, and Dr. OK. We are saying bye-bye and stay healthy.